There's something happening here. What it is ain't exactly clear.
In the blink of an eye, our quiet and safe everyday life can change dramatically when disasters strike. Dangerous storms, earthquakes, fire, epidemics, or man-made terrorism all threaten our world. How prepared are we for these or other events? What can you do to make sure your family is ready when disaster strikes? Disaster preparedness. The doctors are on call tonight.
What's going? We better stop now. What's that sound? Everybody look what's going. We better stop. Children, what's that sound?
Funding for On-Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call Television and our show about disaster preparedness. Disaster planning covers a broad scope of issues from the individual responsibility each of us should take in preparing our family for the possibility of fire, a flood, or a tornado that more commonly occur in our own home in the prairie, to the community, state, or national responsibility in dealing with those same issues, plus hurricanes, terrorist attacks, epidemics, and more. We have the honor of having as our guests experts on state and national disaster planning today.
Hello, I'm Dr. Matthew Owens. I'm a family physician from Redfield, South Dakota. Among other things, I'm the medical director for the Upper Basin Disaster Training Center in Yankton, South Dakota.
Hi, I'm Bill Chalcraft with the South Dakota Health Department.
Roll it up.
I'm the director of the Office of Public Health Preparedness. I'm from Pierre, South Dakota, and I'm a biologist by training.
Also with us today via Skype is Mark Marino, Director of the Emergency, well, I'm losing the Director of Emergency Management for the MediSys Health Network in New York City. He played a key role in developing the Health Network's disaster medical response team. That team has responded to Hurricane Andrew in 1992, the 2001 terrorist attacks on the World Trade Center, Hurricanes Katrina and Rita in 2005, and more recently Hurricane Sandy in 2012. As director, Mark oversees emergency readiness for the hospitals and care centers under the MediSys Health Network. It's great to have these great guests and their resources available for you. But if we are made better, we're only made better by the chance of your questions and a chance to answer those questions. Really, this is a show that's all about you. What is it that you need to know? How does this topic affect your lives? Whether it is a question about whether to find a shelter, how to find a shelter during a tornado, or how to protect your family from a fire, or how to react during a flood, or how are we teaching our medical students to prepare for disaster? It is still your questions that make this show. We need you to call us. And call us early. We have volunteers on the ready, prepared to answer your phone calls or your email questions. Please call us early to maximize the chances of your questions getting on the air and being answered. Please call them and your comments to 1-888-376-6225. Or you could submit them at oncalltelevision.com and click on the questions button. Thank you, gentlemen, all three of you, the two in the room, and Mark out there in New York City by Skype. Thank you for joining us.
Thanks for inviting us.
You bet. Glad to be here.
Bill, tell us a little bit about your position and how long you've been doing it and what you've enjoyed doing.
Well, I've been the disaster coordinator for the health department for about 20 years, and things really stepped up, as you know, after September 11th, and an office was created and funding came along, and we really stepped up the efforts in about 2001.
And that's been, you've been on the show before, and it's great to have you back.
Yes, glad to be back.
Yes. And Matt, tell us a little bit about how you got into this. I mean, you're this family physician in Redfield, South Dakota, seeing sore throats and delivering babies, or used to.
No, not doing the baby delivery thing, Rick.
Okay,
Stop
but
it right
you've
there.
taken care of heart attacks and
Right,
all the things.
trauma and
trauma
whatever we have to deal with. Yeah.
So how did you get into disaster?
Well,
planning?
part of it goes back to I was in the military a lifetime ago, I guess, but looking at how students rotated through my clinic, my hospital, they didn't have even basic training on what to do when you're in what we call an austere environment. Remember, Rick, a disaster is just simply defined as when you have more problems than the gear and the people to deal with that problem. So in Mark's case, a disaster would not be a two-car accident with multiple people hurt, either in Brookings or New York City, where basically in Spink County, if you have 3 or 4 critically injured people, it follows the same dynamics as a disaster. So you have to prepare, train, and retrain in order to provide the best care for those people.
So, but you had this military experience. You're practicing in a rural area, and then you went to an AMA meeting, or what happened that you got connected with Mark Marino, for example, or Bill Chalcraft?
Well, I got started working with and taking courses in the National Disaster Life Support Foundation. It's got a series of courses that are directly trained for not just healthcare providers, but anybody involved in the EMS system on how to appropriately plan and respond to disasters. The best analogy I can make is CPR. You learn CPR in, say, where Mark's at in New York City, the same training you get in our training center in Yankton.
Right.
So if you have a problem, let's say at the mall, CPR analogy, 2 people that don't even know each other know what to do and what sort of processes you're going to follow. That's why there's this integrated national, it's actually international training centers all over the world, system of courses, and it's called NDLSF.
And you went to one of those because you were director of your ambulance, and suddenly you ask a few pertinent questions, and suddenly you're involved, and then you've grown in stature in that particular part.
Yeah, we started off, I think I took the training about eight years ago, and then starting about 3 or 4 years ago, we are a certified training center here in conjunction with USD School of Medicine.
Right. And Mark, you're out there in New York. How did you get started in all of this?
Well, I started my career with MediSys Health Network about 30 years ago. I started with Jamaica Hospital as a paramedic in the New York City 911 system. And my career blossomed from there after spending probably about 4 or 5 years on the street as a paramedic. Took a job as a training coordinator and then became director of the paramedic program. And from there, I got into disaster management, which I guess that was back in 1995. Seems like a lifetime ago. The disaster program has flourished, and as Bill mentioned, certainly since 2001, our efforts have stepped up significantly.
Right. Where was your involvement with 911?
Our hospitals, Jamaica Hospital Medical Center and Flushing Hospital Medical Center, are located in the borough of Queens, New York. The Jamaica Hospital is the closest trauma center to John F. Kennedy Airport. We mobilized our teams. We had 9 ambulances at the World Trade Center that morning. One of those ambulances was, because it got there so early, it ended up being destroyed in the rubble when one of the towers collapsed. We also sent later in the morning teams of physicians and mental health workers in our 2 mobile medical units to the scene. And those crews, although they relieved on site every 12 hours, those crews stayed in place for 5 days until the end of the day, Saturday, providing support for the first responders at the scene of the World Trade Center. So all in all, our staffing level at the scene was about 50 to 55 people at any given time.
Incredible. I'm sure a terrible experience, but at the same time a wonderful one that you were able to be there and to support those people and through all that. Matt, you were going to say.
I just, in review of some of the data on 9/11, it was truly amazing, their response that they were able to, what they could put in the field under short notice. Yeah.
Well, in New York City. Bill, any comment about 911?
Well, it really woke us up, and it helped us prepare for real world. South Dakota's not a real high likely terrorist target, but yet preparing for terrorism, preparing for bioterrorism helps us prepare for pandemic influenza. It helps us prepare for flooding, helps us prepare for any hazard.
Tornadoes.
Absolutely.
The whole thing. I mean, it brought us all up to a higher level of alertness. And what do you think would be the biggest disaster? I'm going to ask Mark, what is your fear or the greatest potential for disaster for you in New York City, or what are you geared up most for? I would presume it would be something like a terrorist. But let you answer, and then let's throw it back to the South Dakotans.
Yeah, that's an interesting question. Our approach to disaster planning is an all hazards approach. We have to be prepared for just about anything. New York City currently has 8 million residents. That number goes up during the weekday when people commute into the city for work. So we need to be prepared for anything. What keeps me up at night is probably a biological release. That's probably going to affect us the most. It'll have a somewhat slow onset, and it'll take a while to identify. There's no bang when it comes to biologicals. It's just it happens slowly, and then it gets it could get out of control quickly.
Right, and National Geographic, I was checking that out just this week. It's talking about if the water rises and in the global warming scenario, how hard it's going to be on New York City if there's a storm that comes. Any comments about that?
Yeah, we learned a lot of lessons with Superstorm Sandy. Interestingly, Superstorm Sandy was not a hurricane when it made landfall in New York City. But in fact, it was the storm surge that really did the most damage to that area. We lost a lot of property, a lot of injuries, a lot of deaths due to the water rising. And as the global warming gets worse, they say that the water rising will become worse as well.
So let's take it to South Dakota. What do you think our highest level of potential for a crisis or a disaster would be in the years to come?
For a statewide issue?
Yeah.
No question in my mind, influenza.
Really?
Yeah, a multi-drug resistant novel H27I, whatever the gobbledygook numbers. But yeah, something that none of us have any resistance to, something that we don't have a vaccination for. To me, that would be that'll keep you up at night.
And Bill, your comments about that?
I absolutely agree. The resources will be tapped all across the country, and we're going to be right in the middle of it.
Right. I mean, it brings you back to the epidemic of 1917, 18, where it wiped out, you know, a third of the population where they were exposed. Didn't wipe out places where they isolated themselves.
Right.
And that's one of the more important keys, I think, as it comes.
The other thing on that, when you study, it's interesting, you know, back in the day it would take them, what, 3 months to get around the world on a ship or by plane, train, or whatever. Not plane, obviously, but. And now that same influenza bug that could be down in Thailand or Vietnam could be in Brookings, South Dakota 2 days later.
Right. I want to make a comment. We had a package about flooding in Pierre that we're not going to be able to show. You can go to the internet site. We'll have that up for you later. And we will be showing that at the next Ask Anything conference show that we'll have. We won't be able to have it for today, which is disappointing, but that's the way it goes. But we do have something else. Training and education are valuable when it comes to preparing for disasters. Training. Medical students and other individuals from all over South Dakota met in Vermillion to train on how to be well prepared for any unseen disasters.
In February, hundreds of students, healthcare professionals, and educators came together at the University of South Dakota. Their purpose? To improve their knowledge of how to prepare for and respond to disasters. Dr. Lewis Marshall, chairman of the Department of Emergency Medicine at Brookdale University Hospital in Brooklyn, New York, spoke at the event.
I do a few of these a year, mostly on the East Coast in New York, and this is the first program that I've seen where they're actually teaching a large number of students, medical students, nursing students, and I think that South Dakota is way ahead of the rest of the country in this aspect and training students in disaster response and preparedness.
A strong and prompt local response to a disaster offers benefits that don't come to communities that simply wait for help to be delivered from miles away.
In the event of an emergency, having somebody at the local level who's been trained is really the way you want to go, because they're ready to go. And as we know from all of the disasters we've seen in this country, all response is initially local. It's the local health community and the students that really have to step up and respond to the disaster. So whether it's an influenza or flooding or some other disaster that we need a lot of people to respond to, it's going to be a local response.
To further clarify what is necessary in regards to an effective local response, Dr. Matt Owens from Redfield, South Dakota, explains more about what the word disaster actually means.
One of the things that we have to look at is the words we use. We talk about disaster, and immediately people think about 9/11 or Katrina. And really a disaster is when your needs or the things you need to do for those patients exceeds what you have locally available. Well, that's not an uncommon occurrence in South Dakota. So these students are trained on how to respond to not necessarily the Katrinas of the world, but let's say multi-car accidents. How do you triage people? How do you train them?
Deanna Lassegard, a nurse and paramedic from Rapid City, South Dakota, is one of the people attending this event.
Oh, it's so important because you don't expect for these things to happen. You need to plan ahead of time and have things set up and prepared, because at any point in time a disaster could happen. And when you have a group of trained individuals, especially from multiple disciplines like we have today with medical school and nursing and PAs and social workers and things like that, we've got a team that's ready to deploy within South Dakota for any disaster that would happen.
South Dakota's Lieutenant Governor Matt Michels also attended this disaster preparedness event, and he says South Dakota should be grateful to those who participated.
Well, I was asked to come and talk with the students about what we need in South Dakota, and also thank them for participating, along with the organizations that are collaborating. I want to make sure that the young people who are here of all disciplines understand that we need them in South Dakota, we need them in service, but also thank the individuals and the organizations for collaborating, because a lot of states don't get this type of cooperation. We really have to work as a team, whether it's nurses working with pharmacists or occupational therapists working with physicians of all sorts of backgrounds. The one goal that everyone has is service to others, and especially those in need.
Join our conversation and call in your questions or comments about tonight's topic. Call 1-888 888-376-6225, or email your questions at oncalltelevision.com. Again, love to have your questions, 1-888-376-6225. Well, Matt, that was a film that we used about 2 years ago.
Correct.
But we're still doing this program with these med students and the pharmacist students and the nursing students. Tell us about that.
Yeah, every year we're growing. We started, 8-9 years ago, and we started just with medical students, and then we had kind of an aha moment that disasters are not just about training medical students. We now have 11 different disciplines from both SDSU, USD get together. We have a full day of training. We do the National Disaster Life Support Core course, and then they have a whole afternoon of hands-on training so that they actually are able to do some things like respond to a pod. And we've tied it. If they want to be deployable assets or force extenders, we basically tie them back to their home communities. So if the governor would have a request, let's say, massive pan flu epidemic, we need people out there giving shots, they'll deploy to their hometown, fall in on that clinic or that hospital, and act as a force extender.
So deploy, in other words, we're training these people so that they would be available on an emergency basis.
Absolutely.
And they're actually would be out there in the field if we had a disaster. And we could call them, boom, they would be there.
Yeah, the state, Bill can tell them about that ServSD. That's kind of weird.
Yeah, what is ServSD?
Well, ServSD is our statewide registry of medical and non-medical volunteers, and it's essentially a way to coordinate those volunteers and to determine what their skills are, what their deployment preferences are prior to an event happening. So it saves a huge amount of time in deploying those resources.
So, I mean, I for one, were dragged over to your table 2 years ago to sign up and say I would volunteer if there was a disaster and you needed extra people. And I think then you wouldn't have to go through a list, try to talk them into coming. You can just call the number of people who've volunteered. Now, how many of our physicians have done this? Enough of them? That's my question. Not enough of them.
Not enough.
Not
we
enough.
need more.
Now, it's interesting with our students, and I think this is one of the things that we started when we started training the students to get that public service thing going. Our students have a pretty darn high rate of signing up because I basically tell them, do you want to be able to go home and help out your local community?
Okay.
Yeah, disasters are kind of like government. Everything starts local.
Well,
Right.
even before the training, before the disaster training day, those medical profession students have skills above the average person as far as medicine goes. And so with the training and with the guidance of a licensed physician or a licensed nurse, they can really provide much needed labor.
And we've integrated law. We've actually been to the legislature. There is a law on the books that basically says if you're under the ServSD and you're a deployed asset, you come underneath basically sovereign immunity, I guess is the term. So there's not that restriction. What happens if I do something wrong and I get sued? So we've got them covered.
So here's a call to the people out there to go to your physicians or your nurse practitioner, your PA, and say,
Your pharmacist.
or your pharmacist or the nurses, and say, are you a part of servesd.gov?
.com.
.com.
No, it's serve.sd.gov.
serve.sd.gov. So, and if you are out there and interested in being a volunteer from wherever you may be, whatever your experience, if you're capable of and interested in helping, go there.
Rick, can I add one thing?
Yeah.
We're also recruiting retired and inactive professionals. So if you've let your license lapse, we still have a spot for you.
We can put you to work.
Absolutely.
So what's that number again?
Serve.sd.gov.
All right, so we've got questions. How does someone volunteer to help in a disaster? There it is.
But you do it now.
So do it now.
You don't do it the day of. There's a term that Mark Marino may want to comment about this. We call them spontaneous, unaffiliated volunteers. They're not a help, they're a problem. If you look at the data from, like, let's say the Joplin tornado disaster, those folks that showed up, quote, to help, were actually in the way of providing services. If you're not registered and you're not credentialed way in advance, we cannot use you. You're better off staying home.
But the liability is protecting you if you're one of these people. So really, the time to volunteer for something that could happen a year from now
would be in about 30 minutes when the show's over.
Right, now don't do it while we're watching this thing. But you want to do serve.sd.gov and sign up for this. And that's a question from citizen. We didn't plan it. We appreciate that call. That's exactly what we're looking for. We have another question from Brandon. Who would coordinate a statewide disaster, and how about a citywide disaster? How's that coordinated?
I'm going to throw that over to Bill.
Well, the state has a really state-of-the-art emergency operations center, and Christy Turman's the director of emergency management, and she works with the governor's office, and in the event that a disaster exceeds local resources, they make the decision to open up the state emergency operations center. And then state agencies, private companies, a lot of resources come to that operations center, and their sole purpose is to assist that local response to the disaster.
Wow. Let's be clear though, as some previous disasters, there's been some issues, not in South Dakota, other states. The request for that assistance has to come from local government then goes to state government. If state government then determines it's outside of their scope of what they're able, that's when the federal piece comes in.
All right.
The federal government can't come into Brookings County and say, you have a disaster, we're here to help. It doesn't work that way.
All right. I'm throwing this to Mark. I've heard criticism of the response to New Orleans and that whole issue of the local calling the state, calling the national, and then the delay and the problems that occurred. Do you have any insight into what happened there or could have happened better that we've learned from the New Orleans disaster?
What we've learned from the New Orleans disaster in particular is there needs to be ongoing communication, not when the hurricane or disaster strikes, but it needs to be being done on an ongoing basis long before the disaster strikes. The local governments and the local emergency management offices need to have an open dialogue with their partners in the state in order to make sure that there isn't any boundary issues, any turf wars, and certainly when they shouldn't be shy about asking for the help when they need it. And I think that was a real lesson learned from Katrina and other large-scale incidents as well, where we've seen the same phenomenon occur, where the local agencies are perhaps maybe too proud or just don't have the level of comfort to reach out to their state partners to ask for help.
Any stories, Mark, about what happened in New Jersey and New York this last hurricane or near hurricane or whatever it was, as far as what happened good and then what happened bad?
Well, the response to Superstorm Sandy was extremely large, and there was a high level of cooperation among the local agencies, the state agencies, and across state boundaries. I think that it really shows that we can learn from all the reviews that we do after a disaster, and we take that information and move it forward, and learn from it, incorporate it into our plans. There were numerous events that took place where the level of cooperation, both on the ground and in the planning and response towers, where the decisions are made. Numerous stories about how things just worked better than they had in the past. So, Superstorm Sandy was a tough couple of days for us. We They threw us a couple of curveballs, including a gasoline shortage, a fuel shortage as a result of the storm, because we couldn't get fuel, not only because there was no power in the region and the gas stations couldn't pump fuel. We're kind of accustomed to that, and we have provisions for that. But the refineries couldn't get fuel to the region, and therefore we had a fuel shortage. And then shortly thereafter, once we did get fuel from FEMA, we were pumping fuel from FEMA trucks for healthcare workers. We were pumping that fuel in a blizzard. So on October 30th, we had a blizzard on top of Superstorm Sandy. So it was quite the few days for us.
Well, that and winging it with every scenario is different. I mean, how can you be prepared enough? I mean, that's it. So, because we've got these fabulous people working behind the scenes, Lowell Haig, this fabulous what a guy. He pulled through. We've got the story about the flooding and this is a good one, about what happened in Pierre. Water is a powerful force, both good and bad. For example, powerful currents from rivers or streams can generate electricity, but river currents can be destructive when unleashed by Mother Nature. Flooding, whether from a river or a lake, is not uncommon in South Dakota during the spring, often along the Missouri River, as many communities and their residents know well.
The flood started around May 22nd, and we got back in around October 22nd. So it was about 5 months that we were out of our home total. And during that time, we had to move in town, buy a house. We had to store all of our worldly possessions, including all the stuff we stripped out of our house. Water levels were raised, and the residents were basically given anywhere from 2 to 4 days to prepare. A lot of the individuals responded to their own personal homes. We contacted family members and people in town to kind of help us get sandbags. We were allocated 100 sandbags per person through the county, and people from Pierre and Fort Pierre were going to these centers. We would then have to fill our own sandbags. They would drop off sand, and you could fill your own and take them to your area. And depending on your house, you would need to get resources to kind of help with that. Most of us on the river needed to build earthen dams, and we knew right away that sandbags would be difficult. And depending on what the Corps told us, we would build to a height. We were given instructions on what the water levels were going to be, and then we would shoot elevations using some engineers or contractors and try to build our walls to that level. The county was really pretty good at trying to assist us. The folks were out there kind of trying to help us with what resources they had. But a lot of us as a group were working as a tight neighborhood to kind of help each other, with materials and any ideas that we can share. Once you lose your electricity in a flood, it's a major problem. We had to pull in gasoline generators. I had 2 gasoline generators. Yeah, there were some resources available. In particular, capillary counseling and some of the city of Pierre had some websites that could direct people for, flood relief and stress. I went out twice a day to my house, 6 in the morning, 6 at night, wondering if a generator had stopped or if my concrete floor in my house had collapsed and if my house was full of water. So, people had to, take measures either medically to kind of take medications or to counseling. Those were all available during that time period. And I think that went pretty well, considering the large number of people exposed to that trauma. A trip to our house, we would go out and take materials, whether you take out gasoline or a new pump, and you go check the house. In this video, we're taking my wife, her father, and my son and I are heading out to look at the berm. And as we come on the house, there's around 5 feet of water on the outside of the house, 5.5 feet of water. And we come up on the berm, and you can see over the top of the berm how effective it was. Where our pumps are working, we have green grass in that spot. And then in the corner, you see a skunk that kind of shows his face. And like every other animal in a flood, they're looking for a dry piece of land. And so that skunk found a dry piece of area there, and my wife commented that he was pretty cute until he squirts you. So we avoided him and went in the house, and that was pretty much the end of it. Just kind of shows that Mother Nature would find ways to take care of itself.
Wow, thank you for sharing that, Rob. And it's fabulous news that your house was protected by your huge effort and all of the support that you found around Pierre to help you with that. The film of watching you putz up to this level and look down 6 or 8 feet to where your house is, but you survived, and your house did too. Well, those of you out there, join our conversation and call in your questions or comments about tonight's topic. Call 1-888-376-6225 or email your questions to questions@oncalltelevision.com. Yeah. So, comments about the flooding, either one of you.
Yeah, I had the pleasure, quite right turn to be in the EOC when it was about 160,000 cubic feet. And to watch the logistics of people calling in for X amount of bags, we're not talking about 10, we're talking about semi-loads, and watch that process go through that operations center and have that become actualized in 5 to 7 minutes. There'd be a crew taking bags and sand and whatnot out, was pretty amazing. The other thing that I think was amazing on the whole thing was the ability of the South Dakota Governor's Office to every day we had the flood fight updates, so people were aware of what's going on. It keeps a rumor mill down. Is what it does.
Right. So, Bill, you were there. Were you flooded?
Yeah, we were. Not to the extent Dr. Allison was, but ours was more from rainwater than it was from floodwater. The dikes that they built, and then they would go over the top of storm sewers, and so they'd plug those storm sewers. And unfortunately, in the month of June, we had 3 rains that were, well over 2 inches each time. And each time it rained, those berms would fill up behind the berms, and they'd flood our house. So, yeah, we had a long summer too.
So people talk about plugging sewers so that they don't back up into your basement. How do you handle that? Do you have recommendations about plugging sewers?
Well, my recommendation is talk to your plumber first and do it now. Put in a backflow preventer, put in a check valve on your sewer line, and that way it's in place.
You can have one in place that actually works whether there's a flood. Does it restrict the flow out when you're trying to?
No, they've improved the design on them, as I understand that. It used to be they were kind of a nuisance that they would plug up on occasion, but now it seems that there's less issues with them, and they're just in place, and normal flow will go right out into the city sewer. But when there's a surplus of pressure in the sewer line that starts backing up to your house, it flips a valve shut and blocks that sewer line.
So that's a point to everyone that if you don't have that in your home and you've ever had backup, or if you're in a floodplain, it'd be something to consider.
Rick, can I add one more thing?
Yeah.
Check your homeowner insurance too. Oftentimes it won't cover sewage backflow, but you can add a rider to your homeowner's insurance for a small amount.
Okay, that's a great thing. And flooding is, that's the big issue. Your basement fills up with sewer. Now I've heard this. I've heard that if you block your sewer, that's one thing. But if water is coming in from the sides and you're not able to sump pump it out, you can fill up with quite severe a lot of water. And if it's going to happen, some people have said fill your basement with good water, clear water, to prevent the pressure from the bad water outside. Have you ever heard anything like that?
I have, and I don't know.
North Dakota people did that, I think.
And I don't know if I would recommend that, but there's really more concern when you do have a flooded basement and there's still that high hydrostatic pressure in the soils around, and they rapidly pump out their basement. and that has a tendency to push the basement walls in. So they recommend lowering it in stages.
Okay. Bad experiences are often relived again and again in our minds. People of all ages who experience an ordeal that threatens physical harm can develop post-traumatic stress disorder, more commonly known as PTSD. It does not only affect war veterans, but anyone who's had to face life-threatening situations like natural disasters.
The people who do disaster relief work, it's basically trying to get people together who've experienced the same disaster, and it's mostly group therapy is what works best. And they have to figure out how they can somewhat relive it but not get overwhelmed by it. The people that somehow make the transition out of it are those that don't get the flashbacks or have coping skills that help them deal with those flashbacks when they get them. Huge individual variation. You know, some people, you know, get it fast and they get the tools that they need to sort of deal with the flashbacks when they get them, and other people would stay very stuck and it doesn't seem like it goes away ever. And you know, it's partially dependent on the severity of the trauma. You know, people that were Holocaust survivors out of Nazi Germany, really, that group never got out of it. And I think some of the people that were in Nam are never going to fully get out of it. People coming back from Iraq and Afghanistan, if I had to predict, you're going to see some people with the same kind of problems. But anybody who's been through a traumatic event, no matter who they are or how psychologically healthy they are, they're going to relive that somewhat. The best studies really are coming out of the VA system right now, where you're dealing with all these people returning from Iraq and Afghanistan. And the modality that the real clear works best probably is the group therapy. And the trouble is, a lot of these people, they don't want to be in a group. They get so frightened that the last thing they want to do, and you can talk them into, is a group modality. And then the research coming out of particularly VA systems, nothing else is working better.
Well, that's great help. Marty Johnson, Brookings psychiatrist, grew up in Brookings, now lives in Seattle. He comes back for reunions. We grab him and pump him for every ounce of information we can. Thank you so much for that, Marty. Any comments about post-traumatic stress that the two of you would have?
The earlier you have an intervention, the data is clear. Not going to alcohol, not going to illicit drugs. Get that help started before you end up down that path. Because once you go down that path, then you got two problems. You got PTSD and a substance abuse.
And would our New York expert have any particular comments about post-traumatic stress?
Yeah, during 9/11, that was a real bad issue for us, both with civilian and first responders. We put together a mental health response team that went on for over a year, where we were visiting firehouses and police stations, providing counseling to first responders who were still having issues trying to deal with the after effects of 9/11.
They're probably still dealing with it to some degree. Thank you for that, Mark. We have a question from here. And does South Dakota have supplies in place to handle a big disaster? Bill?
Well, again, it's hard to predict what the next disaster will be, but we have taken a lot of steps to put supplies that we think are going to be critical in a cache. And an example are N95 masks. If you recall the SARS outbreak in Canada and China, you couldn't buy an N95 mask anywhere in the U.S. They were completely consumed. You know, so we've stockpiled items like that. Needles and syringes. We've got enough needles and syringes to vaccinate every man, woman, and child in South Dakota. We've got ventilators. We've got close to 70 ventilators. Those are a critical item. And hospitals have been trained to use that particular model. It's a wide variety of critical medical supplies and assets.
No matter how you do it, though, depending upon the thing, you can't anticipate every deal. And I don't know how we could have enough respirators or breathing machines should a bad influenza infection occur.
One of the things I think that I guess I'm going to kind of toot our horn here, as you may be aware or not aware, South Dakota has led the influenza vaccination program for the CDC. We're the #1 state, been so for I don't know how many years. And what we've done in Spink County, I've got a real good group of nurses, support from the local school districts, the county commissioners, et cetera, and our hospital administration. We started out 8 or 10 years ago putting on a thing called a POD, or point of dispensation, where we'd basically immunize all the kids K through 12. Well, once you have those sort of things set up, it's not hard to switch gears and do like we did Monday, and we did meningococciemia vaccine to those that needed it appropriate. It was not painless. People are trained how to do it. You just give me the vaccine, we'll get it out.
If we have access to the important vaccine, it's not if an epidemic occurs, it's life-threatening, but it's when.
Exactly.
Will we have the vaccine? But that's interesting. There's some data to say the influenza and the pneumonia vaccines have a memory that allows us some immunity to these weird things, even if it isn't exactly that. So there's a reason to do that influenza vaccine. And another reason to do the influenza vaccine is to realize that you're not protecting just yourself. You're protecting the immune-compromised people in the communities around you. Don't get a vaccine for you. Get a vaccine for others. It's not about you. We have a caller from Spearfish. How should I prepare my own family to handle a weather disaster like a blizzard? Let's talk blizzards. How do we prepare for a blizzard? Bill.
Well, there's a couple of things. In South Dakota, you should prepare both your car, because we travel, and you may be caught out on the road when that blizzard hits. So you need to prepare both your car and your home.
And in the car, I think most important, a sleeping bag, wouldn't you say?
Absolutely.
And don't travel with a lower than a half a tank of gas, whatever it might be. Any other major things about a car?
One of the things to be very, very careful about, even if, all things being even, don't leave the car.
Stay in the car.
Yeah, we had a death in Spink County this year, and staying in the car may have.
And when you're traveling, have a smartphone or a phone
with a charger.
With a charger.
Or an extra battery.
Or an extra battery.
Yep.
And preparing for a blizzard at home. Candles, a heat source of some kind.
One thing that people often overlook is water, and you can't live without water, and you may lose your water supply.
Source.
Yeah.
So 3 gallons per person, they say, is what you really need,
Yep.
right? And a generator, should people have generators? That's a question that we have from Hermosa.
I would say, I guess where I'm at, a lot of farmers have generators. They know how to run them. They maintain them. I see no issues. I've got one at my place. Frankly, before I flip the switch on that, I'm calling the neighbor because I don't want to zap somebody down the line.
Okay.
So if you know what you're doing, yeah, to me a generator makes sense.
Well, and it should be installed by an electrician,
Yeah.
so that it doesn't backfeed into the grid.
All right, well, we'll be back right after this.
So I've come up with a family emergency plan.
Great. What is it?
It's difficult to talk about, so I'm not telling you.
How will we know what to do?
You won't.
I'm so glad I won't have to remember anything.
And me too. Thanks for this, sweetie.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
The official Boy Scout motto has, since inception, advised us to be prepared, to be on the ready for any emergency, having thought out beforehand how to protect ourselves from disaster. In this part of the country, a significant risk for disaster comes from tornadoes, flooding, fires, and winter blizzards. To be prepared is a motto suitable for all living on the prairie, and examples abound. This spring, a rogue storm hit a prairie lake on a late afternoon, killing one unfortunate person in a trailer home, huddled in the bathtub, trying to avoid injury, doing all the right things, except that person may have been saved by leaving the trailer home. and seeking shelter in a neighbor's permanent home, or even by finding a low spot or ditch, getting low, and covering the head. Experts advise never staying in a trailer home when a tornado-like winds are expected. Flooding from too fast springtime thaws can cause tremendous damage to communities. Authorities advise us to know how to turn off electricity, gas lines, water sources, and to close off sewer lines, all when flooding is anticipated, in order to avoid injury to individual property and to free up public resources to help others. Recently, a middle-of-the-night home fire engulfed a Sioux Falls residence, killing a person by smoke and oxygen deprivation, the fourth death by fire this year in Sioux Falls. That individual may have been saved by having smoke alarms that work, knowing 2 escape routes from each sleeping room, getting low to find oxygen, and in general being prepared for a fire emergency. Last winter, a sudden blizzard caught a person in a vehicle and the individual died trying to walk to a nearby farmstead. Had that person kept at least a half a tank of gas, a cell phone, a sleeping bag in the vehicle while staying put, a life may have been saved. In prairie vehicles, a blizzard kit is essential, and each family should have a blizzard or disaster gear stored away in their home, including 3 gallons of clean water per person, enough food for 3 days, a crank radio, flashlights, candles, and first aid. No one else can make your personal family disaster plan for you. Hindsight is always 20/20, but having the foresight to be prepared could save your life. Well, we've got a few minutes, and let's talk with Mark Marino from New York. Any take-home comments, Mark? Any thoughts that you would like to make sure all of us out in South Dakota would need to hear?
You know, we can't stress the importance of personal preparedness and family preparedness enough. We go to great lengths with our employees to make sure that they have a personal preparedness plan and that their families have a plan as well. We want them to be the rescuers, not people who need to be rescued. So in order for them to be able to come to the hospital and do the jobs that we so desperately need them to do, we need them to be prepared, and we need for them to know that their families are prepared as well. And having a good family preparedness plan that is shared among all the family members, having the supplies that are necessary, being aware of the resources that are available in the regions where the individuals live, where the shelter locations are, how to take care of their pets. All of those issues are so important, and we stress that for our own employees as well as the community at large, but for our own employees especially, because we're able to reach out and touch them so much easier.
Thanks, Mark. Let's ask the question about medicine. And we have a caller from Mobridge about what extra medicine should you have in case, or what about medicines, and what about oxygen, and what do you think?
A couple things on meds quick. I know a lot of the medication plans don't allow you to do this, but if you're on multiple cardiac meds or if you're diabetic on insulin, you need to stockpile a week's worth.
A week's worth?
At least a week's worth.
Leave it in the fridge.
Yep. Back to concentrators is what you're talking about. What we learned from Hurricane Sandy, from some colleagues of Mark's actually, was in the smaller towns, at least in Redfield, we've actually looked up setting up basically an oxygen bar where they come up the courthouse, plug in their
oxygen, have a
concentrators, and they can all weather the storm.
Take the bartender and be.
There you go. Don't have a liquor license yet, but you know.
A beer along the way. Just a joke.
Yeah.
So, Bill, we've got about 30 seconds. Any comments more that we want to make sure people hear?
Well, I would add to that you need to be prepared to be self-reliant for 3 days. So if you are on that concentrator, you should have a backup of some sort.
A generator of some kind, too.
Either a generator or cylinders of oxygen, something to get you by for those first few days till you can get to the hospital to recharge.
All right. Well, this brings us to the end of our show this evening. I sincerely thank our studio guests and friends, Dr. Matt Owens and Bill Chalcraft, and our guest from New York City, New York, Mark Marino, for helping to answer the questions from our audience tonight on disaster preparedness. Thank you for those questions. American writer, filmmaker, and literary icon Susan Sontag said, "Science fiction films are not about science. They're about disaster, which is one of the oldest subjects of art." Until next time, stay healthy out there, people. Well, we can kind of get this kind of fun.
On-Call television is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On-Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Dakota Care, the Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Dermatology, Aberdeen Asthma and Allergy, the Orthopedic Institute, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial.